Well, I guess that introduction worked, give or take. On our end, it was kind of spotty. Unfortunately, that's being a little shakiness with the internet ever since we had the storm. So hopefully on the other end, that intro was smooth. I worked really hard on this new intro for Black Maternal Health Week, so I'm very proud of it. So if everybody didn't get to see it, I will upload it as a separate video later because I'm very proud of that introduction. So hello everyone. Welcome, welcome, welcome. I am very excited to be here tonight. As you all know, whether you are tuning in from LinkedIn, YouTube, or Facebook, it is Black Maternal Health Week. And we are very excited about the celebration and the educational initiative around Black maternal health. The past year in particular, we have seen so many unexpected changes, have seen a lot of news stories that highlight some of the very prevalent issues that still exist when it comes to Black maternal health. From the stats that say that nationally, Black women are 3 times more likely to pass during childbirth, to our state, which says Black women are 4 times more likely to pass during childbirth. Even the stats that say 90% of those deaths are actually preventable. We know that there are so many current stories and conversations around Black maternal health, but there is, in fact, not enough action. And so that's where we come in. We are very excited to be a part of NELA Black Maternal Health, an initiative designed by my nonprofit, the Healing Project, in conjunction with Dr. Jamil Norman last year. And this year we have expanded that team with Miss Latanya Sweet and Miss Zakia Cowles in order for us to talk about the reality of Black maternal health. How do we build community? How do we improve quality care? And how do we improve the overall mothering experience for Black women? I'm very excited because we have a guest that I am very, very thankful for. She is such an amazing woman. She has such a beautiful and bright spirit. And I honestly feel like people all over the place, all over the world, deserve to know Miss Nicole Carter. She is with Louisiana Healthcare Connections. But in addition to being with Louisiana Healthcare Connections, she is also a certified doula. So when they brought her on board, I mean, they were very fortunate, very lucky to bring such an amazing powerhouse. She has an amazing personality. She's very well informed, and she has the ability to connect with people immediately in a way that is not always common when we have the chance to do work in the community or work with people across the state and nation. And so I'm very excited that she was willing to do an interview tonight to talk about the importance of doulas, as well as what Louisiana Healthcare Connection stands for. We want to first start by thanking Louisiana Healthcare Connections for being our title sponsor for our Black Women's Wellness event, which will be held at the end of the month. We'll share more details about that. This is actually the second year that Louisiana Healthcare Connections has been our sponsor. And so we're tremendously thankful that they have been such a vital part of helping this vision come to life, especially in Northeast Louisiana. So before we get down to questions, because I don't want to keep her all night, she is a very busy woman. I would like to start out by reading Miss Nicole Carter's bio. Nicole Carter is a community advocate, certified doula, and entrepreneur from St. Francisville, Louisiana, with a passion for improving health outcomes and strengthening communities. She holds bachelor's degrees in business management and small business entrepreneurship, and has worked in the community in community focused roles for over 20 years, 2 decades. That's a lot of commitment. Driven by lived experience and a heart for service, Nicole became a certified doula through the Mary Hands Network in 2024, later earning her postpartum doula certification, and is currently pursuing Louisiana doula licensure. She actively serves on several community and health focused boards, including maternal health and social advocacy organizations, and she was honored as a Healthy Community Hero by the LSU Ag Center Healthy Communities Program in 2024. Congratulations. With over 12 years of prior service in law enforcement and as the owner of Catering to Your Soul, Nicole brings compassion, leadership, and creativity to all she does. She believes in strengthening a healthy community one person at a time. And in addition to her role as a doula, she is also the community relations representative with Louisiana Healthcare Connections. So she has been spending a lot of time with us here in Northeast Louisiana, and we really appreciate all of the awesome work that she does. Nicole, go ahead and say hello to everybody and whatever else you would like to say before we get started.
Good evening, everyone. First, Jamie, I just want to thank you for the opportunity. I'm so grateful that you would extend this opportunity to me to be part of your maternal health week and all the great things that you have coming up. Here at Louisiana Healthcare Connections, we are so excited. I am so excited for tonight. I am so excited for any questions you guys may have and just ready to give you some education and some resources. I appreciate you again. And thank you guys for joining.
I love it. I love it. I love it. Absolutely. We look forward to all you have to share. One of the things I talked about was how last year we really wanted to push the conversation around doulas forward. We were really trying our best to even find doulas to come on to have conversations because there's been such a big movement nationally and across the state, but it was really challenging. So the minute, I don't know if you remember this, we were in mid conversation, and the minute I heard you mention you were a doula, my eyes got so big. I was like, "What? Wait a minute! Wait a minute! I've been looking for you." So it is indeed an honor because doulas are very important. Um, to the birthing process. But here in our state, we are still doing a lot of growing and expansion around educating people on what a doula is, how a doula can be resourceful, and what you can do to get access to a doula for your support. So we're even more excited to have you because last year, as we sought to find a doula, we just couldn't find one, and this year, literally you fell into my arms and in a big hug, sis. Fell into my arms. So thank you, thank you. We're not going to waste time. We're going to get right down to those questions. So our first question is, can you start off by sharing? I love your story. I love to hear you talk. I love to hear about your life journey. It's so inspiring. Can you start off by sharing your journey and inspiration to become a doula?
Yeah, so my journey into becoming a doula was driven by my passion for women, especially during pregnancy and childbirth. In my role at Louisiana Healthcare Connections, we support about 12,000 births a year. I saw how critical it is for mothers to have someone advocating for them. That inspired me alone. Becoming a certified doula so I can provide that consistent, that compassionate support.
Yes.
I am looking forward to actually becoming that Louisiana licensed doula. Through my
Yes.
certification, it's been great. I've met some amazing women.
I love it. I love it. So we hear the word doula, 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 honey. It's trending, honey, like a catchphrase on TikTok. Okay, but there is a common question from people. Folks want to know, what is a doula?
So, for those of you that may not know, doulas provide the physical, emotional, and the informational support through pregnancy, labor, as well as postpartum. We can follow a mom 6 months to a year after she has the baby. So we don't actually just cut you off because you've given birth. We do understand that afterwards there can be the the mental state of mind that comes in when having a baby, because of course your body has changed. We
Absolutely.
help moms understand their care, prepare them for delivery. We navigate, like I say, the recovery part of it. With Louisiana Healthcare Connections, our Medicaid health plan, and serving about 350,000 members statewide, we know that this kind of support during pregnancy and after pregnancy makes a real difference in the outcomes in our
Absolutely.
state in Louisiana and across the nation.
Absolutely. I love when you talk about how the right care makes a difference in the outcome. Because you make me think about, as we talk about the data, as we look at the numbers, as we study the research that says 90% of deaths among Black women in delivery are preventable. It reasserts that with the right care, the right support, the right program behind you, right, we can turn these numbers around. And I love that.
Right,
I love it.
right.
Absolutely. So, my next question to you is, because this is something we have to explain very clearly, right? Because sometimes I've heard people say, oh, well, if I get a doula, I don't need a doctor. I can just have my baby at home. If I get a doula, I don't have to go into an appointment. They can help me with that part. I would like for you to share with us, okay?
So the
How does
role
your
of
role
a
differ? Go ahead. How does your role differ? Go ahead. I'm sorry.
it does differ. We doulas do not take the place of a doctor. Um, Doctors and nurses provide you with clinical care, while doulas focus on the non-medical support. We work alongside of those providers. We work alongside of, if you have a midwife, your doctor that's in the room, your nurse that's in the room. We assist mom in advocating on behalf of herself. So we're in the room to help mom feel informed,
I love it.
empower mom to advocate on behalf of herself. We believe combining medical care with supportive services and doula care is going to create a stronger outcome for the family as a whole. So we do not take the place of your doctor, of your midwife, nor your nurse. We're actually there to assist them. We're your team while we're in the room. We're a team of care providers there to assist you with your care. So you have an entire team. Your doula, we're your extra support.
So for those who are wondering, I'm looking down because I'm multitasking, so I'm taking notes, and so I'm not disengaged. I'm hearing everything, but it's like being an octopus. And one of the things I love about clarifying this is when you say we are there to work with your doctor. I love when I hear that phrase, because even last year when we had the chance to talk to medical doctors and we discussed the importance of a doula, it was really refreshing to hear doctors say sometimes we need that reinforcement. Sometimes we need help with that direction. And to hear doctors talk about also understanding the benefits of having a doula by your side as you navigate this process is really amazing. The thing that I also think about is, and I know that you're a mother as well, is that childbirth in and of itself is such a tedious journey. And while we would like to believe that we are super women who can handle every single situation by ourselves, there are times when we do need extra support that comes
Absolutely.
from somebody that we do trust. And so when I listen to you talk about the differences and similarities, or the connection, I'm sorry, the connection between the doulas, the doctors, and the medical staff, I think about the fact that what you're building is a comprehensive birthing community. And I think that's a really beautiful thing.
Absolutely. Thank
Okay.
you. Absolutely.
So, my next question to you is that we have seen a lot of increased advocacy for doulas. I told you a minute ago, honey, it's like a trending phrase on TikTok: doulas, 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 right? And I think about just 10 years ago, my son is 11 now. Just
Mhm.
10 years ago, I can remember my interest. Like I wanted a home birth so badly. I wanted a water birth so badly. And so part of that involved a doula. And honey, I was wasting my time looking around up here in Northeast Louisiana because I couldn't find one. At least I didn't know publicly how to access a doula. Now, within my community alone, we have several doulas in this community. Statewide, our state has moved to put programming in place that makes it accessible for you to even be able to get a doula. So my question to you is, why do you think there has been increased advocacy for doulas in maternal care? And how do you think this can change the pregnancy journey for women?
Well, maternal health is a major concern nationwide. It's in the news, is what we're hearing about outside of it being Maternal Health Week. In 2024, there were about 649 maternal deaths reported. That is like 17.9 per 100,000 live births. Think about that. This is down slightly from 2023. It continues to move downward. I believe we are in a good space and we are moving toward greater outcomes.
Yeah.
Over 80% of pregnancy-related deaths are preventable. We know that. According to Center for Disease Control and Prevention, 80% are preventable. Doulas are a part of the solution because we improve the communication, we support the early care to reduce those complications early on. We teach you to get those screenings done early, follow up with your doctor, go to those appointments. Whatever your doctor is prescribing, where it's prenatal vitamins, we're going to encourage you to get those. Take those prenatal items, get those tests done as your doctor instructs you to get them done throughout your pregnancy.
I love it. I love it. Getting those tests done as the doctor instructs you to get them done. You know, earlier today, I had the opportunity to go to a community baby shower, excited as a part of Black Maternal Health. But even just listening to some of the conversations, and they had various speakers that were experts in many arenas, and some of the research that's being done, the part about follow-up is such a big conversation. Being consistent with those appointments, engaging with the doctors. Now, is that the case for everyone? No, it's not. But it is a significant part of the conversation. And so hearing you say that doula is there to help you navigate that, to ensure you're able to stay on top of those appointments, to ensure you're able to navigate those different tests. I think about, honey, whenever I was pregnant and you had to go in and drink that nasty orange liquid, and they did that diabetes test. Oh my gosh. You know what I'm saying? It was just, I wanted to gag. I was like, right. And to be honest with you, I was very nervous. I was so nervous when I went in to do that test, because all I could think is, what if and as much as I went to the doctor, right? Logically, I didn't have a real reason to think this, but anything could happen. So I was panicking, like, what if they say I have gestational diabetes, or what if they say I have diabetes that we never detected, or you know, when you go in and you have to get all those exams where they check the baby, and I'm like, well, what if they say something is wrong with him, or you know, what if they say they need to take me? All of these things go through your mind. They can go through your mind when you're in the process. And so I love the idea that doula is there to really be a coach and support system for you, because stress is also a very big factor when we talk about Black maternal health. It's a very big factor. So thank you for that.
Yes, it is. Starting the prenatal care early and receiving the postpartum care as early, that's so important during your pregnancy, throughout the entire pregnancy. It's so important.
I love it. I love it. So the next question is, I hear you talk about having that partnership, have that support, having that person to help you navigate through there. We know that childbirth deaths and health issues are disproportionate among Black women. How do you use the realities of these stories? We have the numbers, we have the data, we see it in hardcore print, we see the stories. How do you use these realities to guide your work practices and your conversations with mothers?
The maternal health disparities concerning Black women, it shapes everything we do. We know the stories, we know the statistics. We know that maternal mortality rates are significantly higher for Black women.
Yeah.
And many of those deaths, again, they are preventable. I focus on education, trust, and advocacy. When I meet my mom, I'm not only meeting mom, I want to meet mom's team.
Yeah. Yeah.
Who's your team? And if you don't have a team, I want to assist you in getting a team together. That team could be the old lady from the church.
Yeah.
It could be the coworker, your husband, your spouse, your significant other, mom, dad, whoever it is. I'm there first for your education, trust. I want you to be able to trust me because this is such a vulnerable moment in your life, whether it's your first child or your 10th child. Um, with Louisiana Healthcare Connections, we're nearly 60% of our members are under the age of 21. And many of our families, they face access challenges. We work to remove those barriers to care. If there's things that you need, we will give you those resources in your community that you can work with. And it's not just during your pregnancy. Those resources and benefits that we give you, they're going to be available throughout your pregnancy as well as during your post. So absolutely. Trust, education, and teach you how to advocate on behalf of yourself. So if you're at an appointment and I'm not there physically, we've already made a few notes what we need to ask your doctor, the things that has transpired during this pregnancy. We're going to make sure that you are ready to ask your doctor, okay, what if this happens? And what if this happens? As well as your partner.
I want to commend you too, because I was aware of how awesome you guys were. I told you last year. Not only did you all title sponsor this event, but I met you whenever one of your employees was at a school where I was leading professional development. And after she heard me present, she said, "I need to talk to you some more. I just want to find out how I can get in more of these school spaces with you." And that blew my mind. But last week we had the opportunity to attend a luncheon where you basically provided even more information to us on all of the resources and opportunities and support programs that are offered by Louisiana Healthcare Connections. And my mouth was on the floor. I was like, oh my goodness. I did not realize what a wide range of resources that you offer. And so I love that. There are times when we hear people talk about things, and there are times when we see people actually do things. And in that moment, on that day in particular, and I think there have been other moments, right? The day we met, we didn't even meet in Monroe. We met in New Orleans at the Business Expo for the Bayou Classic. So I think all of those things, there was no other health provider there. You guys were the only one. So I think all of these things are proof of what happens when you have providers that are committed to the whole person. And I just have to say that because as I listen to you talk and you talk about how care matters, and I look at being able to connect with you all in different spaces, I fully agree with you, right? Visibility is important because you don't always connect with people in the doctor's office. You don't always connect with people when they're making that phone call in. Sometimes the place you connect with people is when they're out in life trying to take care of business and make things happen. So I love that.
Absolutely.
So my next question to you is, why is Black Maternal Health Week so important, especially in communities like ours here in Northeast Louisiana?
And by the way, I love North Louisiana.
You do.
Some great country people there.
We love you too.
Yeah. So, Black Maternal Health Week is critical because it brings attention to the disparities and solutions. It's a time to just emphasize on the access to care, the education, the community-based support. You guys have an amazing community of leaders and resources, that's available to anyone,
Yeah.
not only expecting mothers, but just everyone, the public in general, especially in a rural area and an undeserved area across Louisiana. Um, it's the access to care and the community-based support. Yeah.
And we love that, excuse me. But one of the things that we do try to see a lot of actively happening is trying to build around that component. So um, just because I try to be part of that solution as well, I'm going to say we definitely appreciate when people see those efforts. So thank you. Thank you very much.
Yes.
So the next question is, how do you advocate for your clients in medical settings where they may not feel heard? And I wanted to bring this up because that happens a lot where
Yeah.
moms say, "Well, I told my doctor, but they didn't respond. I asked for this, but they didn't hear me." Or even, I had someone that said, "When I go in, a lot of times I see the nurse. I haven't seen my doctor." So how how do you advocate for your clients when they feel that they're not being heard?
Yeah. So as I spoke about earlier, again, advocacy starts with education. We find that some moms do not know how to even begin to advocate on behalf of themselves. They may not know that you can ask those questions
Mm-hmm.
that you don't know, that you're concerned about. I help mothers understand their rights. It's okay to ask questions. You need to ask questions. Communicate their needs. You never know. You never know. Your body is actually going through so many changes. If it doesn't feel right, you have a right to ask a question about it. It's your body. Don't be afraid. Also, with Louisiana Healthcare Connection programs, we have the case management. So you'll get a case manager throughout your birth, someone to actually assist you with that as well. We connect members to resources that support those conversations before they even enter the delivery room.
Absolutely.
You have those questions.
I love when you say, you have those questions. Like that phrase alone is like a lot of times we do. The struggle is, when I have those questions, how do I get the confidence to ask them? One of the conversation pieces that we talked about a lot last year and continue to emphasize this year is that you know your body best.
Yes.
You know your body best. You know what your normal experience is. You know what is abnormal. So don't be afraid to say, even if you have to tell the doula, because you still feel too nervous to tell the doctor. Don't be afraid to say what's going on, and don't wait until you get in a danger zone. And now it's a
Absolutely.
rush to the clock to try to get things taken care of. So I love that. I love that. Were you about to say something?
I was just gonna add to that, through the empowerment that we give on those one-on-ones, in those conversations, our hopes is that you're going to be so empowered that
Yeah.
no matter what challenges come your way, you're
Yeah.
ready. You are
Yeah.
ready to ask those questions.
Yeah. 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 I love it. I love it. And I just want to, like, what did you say? No matter what comes your way, you're prepared. Preparation is essential, right?
Yes.
And a lot of times that's what we hear from people. They didn't know what to do. They didn't know what to say. They didn't know what to ask. We hear that a lot of times, right?
Yes.
And so I love when you say that. I want to look. Zakia is in the comments there. One of our committee members. Those who
Mhm.
are tuning in, please hit that share button. Whether you're on LinkedIn, Facebook, or YouTube, please hit that share button. Send this video out to your friends. Send this out to your community. Send it to somebody you know who is expecting or who is planning a family. We had a young lady in the comments that is not yet having a family. She says So when I get pregnant, find a doula. Got it. So we want to make sure that we continue to encourage people. You don't have to be pregnant now, but if you're planning for a family, this
Absolutely.
conversation matters to you. This conversation is essential for you. I love it. All right. So our next one says, I'm sorry. I got so excited I lost my place for a minute.
No
What
problem.
are some, what are some important questions that mothers should ask their healthcare providers?
Man, as many questions as you want.
I love it. I love it. I love it. I love it.
Moms should ask about their personal risk factors, what to expect during labor, warning signs, most importantly, your postpartum care. It's important to ask how to manage these conditions, um, high blood pressure, diabetes, because managing those high risks can prevent the complications coming up to a pregnancy, as well as during postpartum. It is very important to be very, very transparent. I know sometimes doctors come in and it seems like they're in and out. We teach moms and anyone on the call, it doesn't have to be if you're expecting, just trying to get into the routine of today I had a headache, it made me feel this way.
Yeah.
Write that down, that date and that time. So even though you're in the doctor's office, you may not be feeling that headache right now, but because the doctor is in and out, you may not remember, but it's good to actually take those notes. On such and such day, XYZ happened.
Yeah.
It's good to be able just to communicate, whether it's your OB, your cardiologist, whomever. It's good to make note of those things because, again, sometimes when that physician is in front of us, our mind is blank, right? Because today we're feeling okay. And not only are we feeling okay, we may be feeling a little nervous.
Mm-hmm.
So it's quite all right to have those. Everyone has a note section in their cell phone. So, hey, let's use it.
Absolutely. I love when you say everybody has a note section in their cell phone. Look, as a writer, honey, I use it. I'm faithful to it. I'm committed to it. Absolutely. I love it. I love it. I love it. We do have one question. I don't know if you are prepared to answer it. If you are, please do. If not, we will follow up on that question.
Okay.
How, number one, how did you get into this work, which we did talk about a little bit earlier, but if you want to retouch that question, you can. Miss Janet says it is so exciting to see a growing community of doulas and midwives in Louisiana and also across the state, including her state of Arkansas, which I love that they have an amazing communal atmosphere going on. Is there some overlapping between the roles of midwives and doulas?
Okay. So for the first part, I'll try to be quick. I won't expound on it, but I got into this work. I would say a love for the work came from my own personal experience. With Louisiana Healthcare Connections, we have a partnership with Mary Hands Doula Services, and so I am actually certified through them. They are Louisiana wide. You can actually log on to their page, Mary Hands, to get more information about that. They have virtual classes, in-person classes. And the next question was, is there overlapping roles between the midwives and doulas? So actually my last birth in the room was a team that consisted of mom, of course her husband, the midwife, the birthing nurse, myself, and mom's parents. So the team was amazing. We all worked together. The care for mom was extraordinary. I mean, I can't even explain it. But no, we all are one team, healthy babies, healthy mom, healthy babies, healthy outcomes.
That's such a beautiful communal space to hear you say it was like husband, wife, the grandparents, the midwife, and the doula. That's just so, I guess you can even say like an intimate birthing experience that makes it such a sacred day. I love it. That's really beautiful. Beautiful. Thank you for answering that question.
Okay.
So the next question is, how do you support mothers emotionally and mentally, not just physically? Because a lot of times people think it's just down to you helping them with those action steps. But how are you also helping our mothers emotionally and mentally as a doula?
Emotionally support is very important. Very, very important. Pregnancy can be overwhelming for those of us who have experienced birth. Um, the the space in between just wanting to be a mom, it can be very overwhelming, especially for our first time moms. We provide the reassurance, it's listening actively, connecting with the mom, connecting her to the additional resources in her area when we're not there. It's baby showers. It's that community of support, including the mental health support when needed. That part of our broader approach to whole person care. At Louisiana Healthcare Connections, we endorse whole person's care. Also, again, speaking of our case management department with Louisiana Healthcare Connections, you can actually get a case manager where it's a nurse and you actually speak to that person. That person could carry you throughout your birth as well as after your birth. So you're actually talking to that same person who's a nurse, who's a case manager the entire time during your pregnancy. And also, Louisiana Healthcare Connections offer a 24-hour hotline. So you also have access to that as well. It seems like I'm hearing some feedback. Is there feedback? Can you hear it?
I heard there was some signals that were popping up, but I don't hear any on my end. You hear
Okay.
some?
Okay. Sorry about that. Just want to make sure.
Whitney Black says two of my favorite people. Whitney knows everybody. I thought I knew everybody. Okay. I believe that I've been beat out by Whitney. I love her. I love her. I love her. She is family now. She started off just as friend and neighbor, but she is family now, and we love the work that she does too. She has such a passion for community. I love it. I love it. When you talk about emotional support and how necessary that is, a lot of the things that I read when we start talking about what what is the biggest, or what can be one of the biggest impactors of maternal health. So many times we see people talk about the stress, the anxiety, the worry. So what you do as a doula is vital, in my opinion, to really helping expecting mothers feel a sense of comfort. Absolutely. So somebody said that there is feedback. Hmm Okay, let me see. I don't hear it on my end. I've gotten my things turned. So I moved my phone to make sure it's not in the way. So hopefully that'll take care of it. Okay. Thank you for letting us know, Miss Julie. All right. So our next question is the kind of how we got here to Black Maternal Health Week, is the basis of this question, right? I love to talk about culturally responsive actions. Culturally responsive actions are necessary from community to schools. It's really even necessary in our churches when we start talking about, how do we really create a space where everyone feels engaged and seen and heard. But in
Yes.
particular, when we talk about childbirth, a lot of the active work around Black maternal health is regarding the response to these numbers. So the question becomes, How does culturally responsive care impact outcomes for Black women? How does culturally responsive care impact birth outcomes for Black women?
That's a great question. That's a great question. It's essential. It's essential. When mothers feel seen and
Mm,
respected,
mm,
they're
mm.
more likely
What they
to
say?
engage in their
Mm.
care. I'll say that again. When mothers feel respected,
Yes,
seen,
yes.
they're more likely to engage in their care. That leads to better outcomes. It's one reason we focus on community-based solutions and
Mhm.
partnerships that we reflect the populations we serve.
Yes.
Having those community health advisory meetings that you guys were a part of on last Wednesday, that allowed the community of community-based partnerships within Monroe whole come together. Even though you guys were from different parishes, it
Mm-hmm.
was a plethora of resources and
Yeah,
people in there in that room that shared the
I love
same
it.
compassion in the community.
I love it.
Um, so yes, when they feel and I can't say it enough, when a mom feels seen, heard, respected.
Yeah. I love the way you fostered that answer. I said, honey, we might as well pass the collection plate because that was a sermon. When you talk about people feeling seen and heard, because so much of this is about
Yes.
that being a part of it. You know, people saying, I said this. When we go back to the data, right?
Yeah.
80%
Yes.
nationally, or 80% for every woman of those deaths were preventable. 90% or more for Black women were preventable, right? That's
Yes.
about people being seen or heard. So we have to respond to the data. We have to
Yes.
respond to the numbers. We have to respond to what reality is in order to make those changes. I love your response. Thank you for that. So one of my favorite questions, and it's going to be such a big part of the event that we're getting ready to host. What role does community, family, and the village play in supporting mothers? Love that question. Love it.
Everything. Everything. Whether it's family, providers, local programs, having that support system improves physical and emotional health. Louisiana Healthcare Connection, we invest in the community. Community outreach programs that bring people together. So community is number one. You don't know your resources that you have until you tap into your community resources.
Mm,
They're
mm.
right there at your back door. You just have to tap in.
Yes.
Just
Yes.
tap in.
I love that. I love it. I love it. I almost started singing, but I don't think that was you reminded me of a little song out there, right? But I love it. I love it. I love it. Um, so tap in, tap in, tap in, tap in. Get to action. Make it actionable. That's the thing. We have to tap in. I love it.
Yes.
So the next question is, can you share ways you incorporate healing practices, storytelling, and ancestral wisdom into your work? And that's one of my favorite. As a storyteller, as a writer, an author, a speaker, storytelling is such a big part of my life, right? And having a nonprofit specifically called the Healing Project, I think that's one thing I've learned about, I've loved about what I've studied about doulas is a doula isn't just about the action thereof. You really you build into the culture of that person. So I want to pass that question to you. How do you actively incorporate, okay, healing practices, storytelling, and ancestral wisdom into the work you do?
As we talked about earlier, one of the one of the things that shaped me into becoming a doula, it was from my own experiences, right? So one of the things that I feel like I can relate to moms. If it's a teenage mom, I can relate. If it's a young mom, I can relate. I I think it's bringing your personal story sometimes, getting on moms, not I don't want to actually say level, but actually just being able to go through some of the things that mom is going through, and saying that it's okay, because guess what? I myself was
Yeah.
a teenage mom. I
Yes.
myself was a young mom. I myself did not know anything.
Yes.
Anything.
Come on. Come
Didn't
on.
know. So I think it's actually just building that of course that bond,
Yes.
between you, mom, and family, and just actually just talking about your personal experiences when you guys get on that level, just letting her know it's okay. It's
Absolutely.
okay, whether it's that moment during childbirth, that moment just before she has the baby, that moment when she wants to give up, just that reassurance.
Absolutely.
We're in
Absolutely.
the room. You don't even have to be strong right now. You got
Yes.
enough
Yes.
people in here strong enough for you that you
Yeah.
don't have to be strong.
I know
So
I'm the best.
it's those
Yes.
things. Those things are the most impactful moment, and you won't know. You won't know. Every situation is different. Every birth is different. Every pregnancy is different. Even if it's your third or fourth time, every pregnancy is different.
I love that you said you don't have to be strong right now. We're here. So much about this, the Black maternal health movement, specifically for Neela, is about us creating that community of support, creating that community of love, letting you know you're not in this alone. We're all learning. We're all learning about our bodies. I
Yes.
told you we added menopause and perimenopause this year because so often the mistake is thinking that maternal health ends at childbirth, but maternal health goes on, right? And
Yes.
so we incorporate that so that we can bring in stories from the elders, but also talk about those conversations that used to be taboo. So hearing you talk about how basically what's happening is you don't have to do this alone. We can hold space for you when you can't hold space for yourself. Whether I'm an elder
Absolutely.
transitioning through menopause, or I'm your family member that just has your back, or I'm the doula that's
Absolutely.
navigated this process with others 1,000 times and feels equally as passionate about you. So I love it, I love it, I love it. I know I'm not, look, I'm all in the camera doing our CEO fist, hitting the young folks, all of that, because you are hitting those points that really just speak to my heart. And I love it, I love it, I love it. We do have a question from
Okay.
Dr. Salisbury, a retired social worker, phenomenal woman that is always actively thinking and advocating for the community. And her question is, wouldn't adolescent females benefit from having this information to assist them in making the decision to procreate before they do? How can they receive it? So I guess the question is, what we'll speak to is, does Louisiana Healthcare Connections offer any programming currently to help our teen girls in navigating decision making? Because there has been conversation recently about teen pregnancy numbers and things like that.
Um, just thinking offhand, of course, Louisiana Healthcare Connections, we are one of the managed care organizations for the state of Louisiana. We cover from birth to 64. Um, so we do cover adolescents. I can't think of programming offhand. We do there's a lot of teen um avocation. There's a lot of team programs and community support that we support. I'm not sure where Miss Pamela is from. I don't know of any right now, but I can get back with that information to see if there are any organizations in her area that we do support, or that we can link her in, or just a resource guide for her. Yes, ma'am. I'll give you that information.
And I think that that support shows up in multiple ways. Sometimes prevention doesn't always look like being able to hand them specifically a pamphlet, but a lot of the other programs that you guys have as organizations that you guys support in this community. I see somebody in the comments right now that can attest to a program that I think you guys have supported across the
Okay.
community, but I'll let them mention that. And I think that a lot of times that's where prevention work shows up the most prevalently is the work that you all do to support community initiatives with a lot of youth programs and things like that. And even whenever you all were rolling out to show us kind of some of the programs that you have helped to fund projects for and things like that. So I think that that is always a great question when we talk about our young people. But one thing that I admire is that as we were looking at the plethora of things that you guys have done, there were a lot of different age groups. We have people that advocate for senior citizens. We have people that advocate for teen organizations. All kinds of people were in the room, and and so I think that that's key. I think Dr. Salisbury's question is very, very important, right? How
Yes.
are we showing up at every age level? And it was interesting because it came right on the tail of what you said a minute ago about being a teen mother. So you get it, you understand that, you get that. I love it. Did you have anything to say?
One of the I just thought about, we support the Boys and Girls Club across Louisiana. And there may be other ones that come to me. But yeah, I'll make sure that I can get her a program in her area.
I love it. I love it. She lives here in Monroe.
Okay. Okay.
She lives here in the Monroe community. So I love it.
Okay.
I love it. So this is our next question. Okay. What are some things expecting mothers can do to prepare for a healthy pregnancy and delivery? So what would your advice be?
Um, oof. Start your prenatal care as
Mm,
early as possible, number one. Attend, as I stated earlier, attend those appointments, attend all the appointments, even if you have to drink the things that you don't like. You have to keep in mind that you not only living for yourself, but you actually carrying this special one. So two people, and you're advocating on behalf of yourself as well as your baby, right? Eat nutritious foods, even if they don't taste good, even if you don't like the green things, try it. Try it. Um, of course, manage chronic conditions. If you have a condition, be very transparent with your physicians. We have a program which is called Start Smart for Your Baby.
yeah,
It's an app that you can download on your phone. It's very easy. Our members, once they get into it, they love it. It helps moms stay on track with reminders for appointments, education resources in the area. Um, all kind of things are on that website, and it's just downloading the app. It's called Start Smart for Your Baby.
I love it. I love it. I love it. I love it. Um, so I love that you say start smart for your baby. You talk about starting maternal care early, and which is really womb care, right? I shared on a video before about how as soon as I was a person that started, young, just that was the lineage of my family. Most women enter their womanhood phase early. But my mother, at a very young age, started taking me into the doctor to have those visits and to make sure. And I was a person that had a lot of issues growing up because they ran in my family, right? So knowing my family history, knowing which side of the family I took after, because the experience on my maternal side and my paternal side were different, and I took after one side of the family and not the other. So that dictated a lot about my health. So I love to
Yeah.
hear you talk about like knowing early, starting to go to the doctor early, really teaching your kids about their bodies, and I often say we don't have to have all the answers. That was one of the
Right.
challenges, of course, that my mother faced. She didn't always know all the answers, but she tried to ask as many questions as possible. And I think that part, that what you stated a minute ago, is so important about starting early to know what's going on with your body. You don't have to wait until you're pregnant. And after you get through the childbearing years, don't stop that maternal care. Don't stop that wound care. Ensure you continue to advocate for your health and take care of your health. I like that. Did you have anything else to say?
Just wanted to add it. I mean, even if because I mean, there are some moms that may have substance abuse, may have alcohol issues. All of this is very important. There are resources. There are things you can tap into. There are education resources. No judgment. No judgment.
I love it.
We're here for you to assist you. Again, healthy mom, healthy baby. So it's okay to have those conversations with your physician. Don't be afraid. And the fact that you took the initiative to tell your doctor says a lot. You're ready. You're ready to get that help. So why wouldn't we help you? But it's just important to start early, start that prenatal care early. And again, if it's substance abuse, alcohol, no matter what it is, the resources are there. They're there. And we're here to help you.
I love it. I love it. Physicians, doulas, midwives, nurses, all of them. It is a community of care. I love it. I love it. The next question. So this is a big one because we talk a lot about pregnancy. We talk about the delivery. We need to dabble into postpartum. Okay. So what does postpartum support look like, and why is it so critical for mothers?
So postpartum support, that care includes your recovery, right?
Yeah.
And included in your recovery is mental health support. It's your follow-up care. Many complications can happen during delivery.
Yeah.
Ongoing care is critical.
Yeah.
We encourage moms to stay engaged with their providers and use the available resources. If it doesn't feel right after the baby, it's okay. It's okay to have that conversation. I know we have social media there. Sometimes it doesn't look like a happy pregnancy, a happy birth, coming home, everything's perfect. Mom has gone home, mother in love is gone home, sister and brother is gone. And sometimes it just doesn't quite look like it looks like on social media, right? That you should be still happy and excited. Sometimes you're not. And it's okay. It's okay. Yes, it's okay. To get that help, reach out to your doula, reach out to these providers. It's okay. I can say a lot about that, but it's okay. If you're not feeling well, it's okay. You're not the only one.
I love to hear you say it's okay. You're not the only one. Sometimes that's it. That's simply what people need to hear. Like, it's not only you. It's perfectly okay for you to feel like this. Let's go on this journey together. I love it.
That's it. That's it.
And the statement you made a minute ago about how critical it is to follow up with care after the delivery of the baby. I'll be honest enough to say I feel like I was very naive when it came to realizing that there are a lot of women who don't follow up with their doctors after childbirth. I really did not realize what an issue that is. So that's I thank you for bringing that up, because that is a very important point to highlight. That one of the goals of the doula following that care is to ensure that mom is making sure that she is in optimal condition, because you're still in a danger zone. Your body is still trying to readjust. You just pulled a person out that you formulated, okay? Those hands, that skin, those eyes, that heart, the stomach, all of those things came from everything you put into that body. all the cells in your body. Yeah, the father helped, but mama's body had to do the work of carrying to the finish line. And oh my gosh, that is quite a process. So when we
Yes.
put it into perspective, it is absolutely necessary, highly necessary, that moms ensure that they're doing that follow-up care, because your body is trying to get back into the swing of things after you have just delivered this baby that pulled on a whole bunch of things. And not to mention, when they take the baby out, they are literally cutting that little cord. So now you're disconnecting that newborn from you. So that body is trying to readjust to those things. So I want to say thank you. That was a good point, because I feel I was so naive before, so naive when realizing that women going to their postpartum care appointments is actually a bigger problem than a lot of us may recognize or know.
Oh, yeah.
So around, we kind of talked about this in the beginning, but I think this is a chance for us to kind of circle toward the end. I have just two more questions to ask you. The first
Okay.
question is, Louisiana Healthcare Connections does a lot of support work around maternal care. Can you share with us some of the services and projects that you offer? We talked about some early, but if there are any others you want to talk about, sorry.
Absolutely. Great question. We take a comprehensive approach for maternal health. Through our doula services, we offer both in person. I talked about this earlier, virtual doula support. Again, we partner with programs, Mary Hands Network, to expand access and train doulas statewide. Statewide. If you log onto that website, it'll actually tell you where those next classes are. And again, you have that option. If you want to become a doula, you can do it virtually. You can do it virtually. There are some times where it's both, right? It's hybrid. The app that I talked about earlier is called Start Smart for Your Baby. Again, this program provides education, appointment reminders. It's a mobile app, the click of your phone. We've seen nearly 16% of reduction in unnecessary C-section among low risk pregnancies. Now, just because you get a doula, yes, we love to practice natural birthing, right? Natural birthing. If your birth plan is to have your baby natural and something happens in the spur of the moment, and you result to getting medication, you're not a failure. Again, we want you to know that we want healthy mom, healthy baby, healthy outcome. We want you to be able to show up for yourself, your baby, and your family. Another thing that we do, we have member baby showers, right? These are events where we provide supplies, free supplies, pampers, diapers, wipes, health education. We partner with almost every community partner or avenue in your community that has anything to do with children, from birth to whatever age. We invite those partners to our baby showers to be able to empower you and share that information with you, as well as follow up with you after that event is over. So the resources and the information is there as well at those baby showers. All our programs are designed to improve outcomes and ensure moms feel supported every step of the way. Every step.
I love when you were saying a minute ago, you were talking about, like, if you have a birthing plan and that plan has to change, it's okay. It doesn't make you any less of a mom just because it doesn't happen the way you want it to. Um, you know, and it made me think about, like, when I say, honey, I had the ideal. I wanted a natural birth. I wanted, vaginal. I had the plan laid out. I told you I wanted a water birth. So I started out researching that. Okay. Honey, I had been watching the Learning Channel for years, and I was determined to get in that little pool and have that baby in my little tiny apartment. And that just wasn't a possibility for me at that point. But that's what I really wanted. Okay. Well, then I said, okay, well, I can still do a natural birth, right? I can have it naturally. I don't want any medicine. I just want to go through the process. Well, honey, lo and behold, I had a fibroid the size of a softball sitting over my cervix. And so
Wow.
I couldn't even have a regular C-section. I had to be cut hip to hip plus have surgery.
Ooh,
While
wow.
initially that was disappointing, at the end of the day, I didn't care about any of that. I just wanted my baby in my arms safely. So I appreciate you saying that
Yes,
because the end result is the ultimate goal. And sometimes plans do have to change to be in the
yes.
best interest of mom and
Mhm.
baby. I love that you said that. Thank you. So I
Yes.
heard you bring up the baby showers that you all offer. So I felt that was the perfect segue to ask you, what are some upcoming events and activities that you guys have planned for this region that you feel like people may need to know about?
Well, of course, one that comes to mind is your event um, on the 25th, where I'll let you share about that one.
We'll circle around at the end, so I'm gonna let you take up the space. So we'll certainly circle back around to that in the end. Yes.
um, Man, I'm actually drawing a blank. I can tell you there are a lot of upcoming events. We have there is another event. I don't exactly know the date, but I will get it to you. We are having a maternal health activation in Richwood. It will be at the Richwood Community Center. I think it's on Martin Luther King. That event, we will have all kind of breakout sessions, right? It is going to be um, very empowered. We will have everything from lactation consultants. Of course, we'll have doulas there. Um, we will have car seat safety. We'll have food demonstration, food education, just to name a few. So I don't exactly know the exact date of that event. It is in the next few weeks, though. We actually toured um, the community center when we left last Wednesday. So more to come on that one. We are also looking to partnership with some schools in the area, centered around Get Fit, healthy, Get Fit for our students. The last event that we did in Monroe, the teachers were jigging as well. So this one is our Jig Aerobics initiative, which has to do with getting fit, right? Um, can't think of any others right now, but I'll make sure that I get them to you so you can add them on your platforms and you can share that information. Yes, I'll make sure that I get those to you. But those come up because they're actually coming up near.
Well, I think that that's certainly more than enough. So I wanted to share that Miss Evelyn has put in the comments that uh, the excuse me, Louisiana Healthcare Connection Cares because maternal health matters event
Yes.
is going to be May the 23rd in Richwood. And honey, Richwood is
Thank
basically
you.
Monroe. So that is definitely local plus.
Yes.
And I'm excited about that event too, and I definitely look forward to coming down there to volunteer with you guys and just be active in whatever space you need me to. So we're very excited about that. And then you started talking about just working to continue to build relationships with schools across the region and provide their ongoing support, as well as things that they have done in the past. So we will stay, we will definitely be staying in the mix. And
Yes.
any information that you all share with me, of course, I will promote throughout my network because we greatly appreciate the work that Louisiana Healthcare Connections is doing in Northeast Louisiana and across our state. And seeing the authenticity of the organization, seeing how you are seeking to speak directly to the needs of the people, that is something that is really valued when it comes to making changes and impacting the community. We had another question where somebody asked, I'm not sure what they meant by what is the website giving, but how do you get in contact with Nina Black Maternal Health? So we are on Facebook, and actually this conversation is streaming through the Nila Black Maternal Health page. So you can follow their page where we post information. You can also DM us with questions. Nila Black Maternal Health is part of or one of the initiatives of the Healing Project, which is a nonprofit I founded about three years ago. So you will see other initiatives from the Healing Project. All of those initiatives relate to community and social healing, and they involve advocacy and support for women, educational resources, and community building through healing-based relationships. So we are very thankful so much to Miss Nicole Carter for being our guest today, for sharing with us the very beautiful story of her journey in becoming a doula, how she navigates that role to ensure she can provide the best care and support possible to clients, and how it's relevant to the work she also does with Louisiana Healthcare Connections. I also want to continuously express my appreciation to Louisiana Healthcare Connections for coming on aboard again for a second year as our title sponsor for this event. Let me tell you something, you all, I really cannot, the level of excitement is blowing my mind. I'm serious. When I was in Bastrop today at the community baby shower, my phone was blowing up, okay? Registration, questions. They were ready for the interview tonight. People were sending emails, and we had posted the link. We had set up the event, but everybody was so excited. I was getting messages all day. So I shared with you all before, we're very thankful for this partnership and that we are in really powering up this conversation and advocacy for Northeast Louisiana. We are a community that has a specific community demographic that needs this type of up close conversation. And the prayer is that we will really be able to make an impact that continues to strengthen the relationships with our medical community,
Absolutely.
build relationships with those who provide the services that people need, and ultimately engage in brotherhood and sisterhood that provides a wonderful birthing and parenting experience for mothers and creates a healthy environment for our children. I thank
Yes.
you all so much for being here tonight. If you missed any part of this interview, you can start over from the beginning. If you think there's somebody that should have heard this interview that's not here, send it to them right now. If you have not registered for the Black Women's Wellness Luncheon, you all, they put this fire sign on Eventbrite, okay? Honey, that means registration is booming. Please go reserve your seat now. You don't want to miss it. We have some amazing mental health therapists, doctors, attorneys, and even mothers over 40 who will be sharing their stories. We'll be doing community building activities among sisterhood and brotherhood as it relates to maternal history and maternal care. We will also have a very beautiful candlelight vigil honoring those and commemorating those who we lost to child in, excuse me, during or after childbirth last year and throughout this region. So if you are a person who lost a family member, okay, as a result or during childbirth, please reach out to me, Latanya Sweet, or Zakia, because we would love to create a specialized space for you while we honor our family members during that day. And so we'll also have great information available and resources, and all around just enjoy a day of fellowship. Please reserve your ticket on Eventbrite if you have not done so. As always, thank you all for tuning in tonight, and we will see you on Friday night with Dr. Ari Shaw Miles, who is the OBGYN at Ochsner here in Monroe. She will be talking to us about the big P and the big M, menopause and perimenopause. So grab your friends and don't miss the conversation. We'll continue to talk about the subjects that matter when it comes to Black maternal health. Thank you all so much, and good night.
Thank you. Good night.